Welcome back to Uncommon Experts. We're here with Dr. Michael Reeves of Medical Park Family Care. Thanks for joining us, Doctor.
Nice to be here.
First thing I'm wanting to know is that you guys do a lot of emergency or actually urgent care.
Minor emergency care, urgent care, same thing.
What's the difference between going to you and going to the emergency room? What do I come to you for?
Well, we're able to handle what we call minor emergencies. In other words, a non-life-threatening emergency. If you cut your hand, even though it might be bleeding severely, if you put pressure on it, it stops and it needs some stitches, you can come see us. If you break your arm, but it's not horribly disfigured or,
no bones sticking out.
Exactly. I was not going to go there, but yes, then you can come see us. We can get an X-ray, oftentimes faster than you would actually wind up getting it in the emergency room, just because of the way we're set up. We have X-ray on site. We can be looking at that X-ray in a few minutes, whereas you go to the emergency room, who knows what you might have to wait for. They triage, and the life-threatening cases will go in before you.
So when you're triaging at your facility, you actually are the life-threatening case compared to the guy who's getting an immunization or
well, hopefully we aren't seeing a life-threatening case. I mean, that kind of stuff does need to go to the emergency room. But, even someone who's in severe pain or someone who's holding pressure on a wound, or someone who thinks they may have a fracture or something like that will get pushed to the front of the line, so to speak, and we try to get those people in quickly and get them taken care of.
I know another thing that we often don't think about until it's too late, and then you've got kind of an urgency to get in, is travel medicine. Do you guys do that as well?
Yes, we do, and it's always nice to give us 6 months before you leave. And a lot of times people don't, but we do an extensive amount of travel medicine. People going all over the world. We have all the vaccinations, the typhoid and yellow fever and all that stuff right on site. It's a very good place to do that. We frequently will see whole families that are traveling to several countries or whatever, and we have the facilities to bring that up, give them the right immunizations, and protect them while they're traveling.
It's nice to know. Now, when you think about family medicine, we always call it cradle-to-grave medicine. Why don't we start on the cradle side? What are you able to accommodate there? We
can take care of a child as soon as we can get to them. The same day they're delivered, really, they can come under the scope of family medicine. And there are some family physicians still that deliver babies, although not so much in Anchorage. There are a few, but we don't do that at Medical Park. But the day they're born, we can start taking care of them for their well-child checks and their follow-up maternity checks. We can see mom and the baby and take care of everybody, all in the same visit, basically. From that point, we do the well-child checks, the immunizations, screening for, congenital abnormalities, heart defects, that kind of thing, right up through adulthood,
Well, on the mom side, what kind of women's medicine do you guys do?
We do basically everything except delivering babies. A couple of our physicians there are several of us there, and everybody leans a little one way or another, although we're all family physicians and do it all. But we do routine female exams, as well as some abnormal, for abnormal situations, abnormal pap smears, that kind of thing. We have physicians that do colposcopy, and of course we do.
Do you have ultrasounds?
We have ultrasound, which we do occasionally for obstetrical reasons, but we do it for non-obstetrical reasons as well, pelvic pain or abdominal pain, that kind of thing. And we have that on site, which is very handy.
What about things like contraception issues?
We handle any kind of contraception other than surgical, whether you need birth control pills, Depo-Provera shots, all that kind of stuff. We do counseling. We talk to young ladies, do pretty much the whole gamut.
And men's health?
Men's health, prostate checks, annual physicals, cholesterol and blood pressure, of course, are important for everybody, but that's a big part of men's health and women's health. Do it all. We do EKGs on site, just about everything you'd need.
What about for the kids? Could you do things like sports physicals?
We do a lot of sports physicals, do a lot of the school physicals, keep them up to date on their shot records. That's kind of the whole idea of family medicine, is to cover this whole gamut so that your shot records are in one place. When you go to start back in school, you know when you had your last tetanus shot and your last hepatitis series and all that. We do the sports physicals, Boy Scout physical, any kind of physical exam you can name, we're prepared to do.
And other than the annual checkup, what sort of things do you offer adults?
Well, we, of course, have the acute care for anything that happens. You know, if you fall down, cut yourself, and break your arm and all that kind of thing, get sick.
Postmenopausal health is a big deal right now for women. What kind of services do you offer then?
Well, of course, you know, a lot of that is counseling and talking over. Some women are appropriate for hormone replacement therapy, some aren't. It depends on family history and a lot of factors that could play a role there. We talk to them. We do, that's kind of part of the annual physical exam. Of course, mammograms are important, as well as the rest of the physical exam, colon cancer screening, cervical cancer screening, all the stuff that you need, ultrasound if it's necessary. Women also need their blood pressure and cholesterol checked.
I understand that you also do lap band adjustments.
And one or two of the physicians do lap band adjustments in our clinic too. So after you have the surgeon put the lap band in, come to us and you can get it adjusted.
Thank you for joining us, Dr. Reeves.
Thank you.
And thank you for joining us on Uncommon Experts. I'm Doreen Lorenz.